Hello everyone, welcome back to MedBites. Today our topic of discussion is concussion. Oh, that rhymed. So today we're going to talk about concussion. So what is concussion, right? A concussion is a mild traumatic brain injury. So how does somebody sustain a concussion? So you do know that your brain is a mobile organ inside of your skull. If this is your skull and this is your brain, it's sort of floating in the cerebrospinal fluid, right? And it moves. It's sort of like a baby within the amniotic fluid. It moves along with everyday movements of the head. But what happens when you have a when you have when you hit something, for instance, it undergoes two movements, and it undergoes what is called coup and counter coup. So the brain hits the inside of the skull, and that's how the brain sustains the brain injury, which then later presents as concussion. So what's going to happen is, you do know that your there are so many tracts that go up and down, and then if your brain moves and hits the skull, there's going to be some amount of shearing. They don't actually break off, or there's not any obvious structural injury to the brain itself, but it's still traumatic for the brain, because it's like a bowl of jelly, right? And you're moving it a lot more than it normally moves, and you're hitting it against another hard surface. So that's how the brain sustains a concussion, right? Now, how does a concussion present, right? So the patient, first of all, the biggest one is headache, right? And they're going to have noise sensitivity. They're just like, oh, shut up, you're giving me a headache. And then they could have light sensitive photosensitivity. They find that everything is just too bright, right? And then they could have emotional lability, they could be irritable, they can have behavioral issues and such. Then there could be nausea, vomiting. Some of them could even have loss of consciousness. Yes, and confusion, poor focus, slurred speech, impaired gait, and they could have sleep disturbances, right? Sleep disturbances. Okay, so these are all of the presentations of concussion. So what do you think is the most common scenario in which a person can get a concussion? Okay, so we're talking motor vehicle accidents, right? We're talking soccer, when kids hit the ball with their head or something like that, and just like it's a sports injury. It could be a sports injury, right? And just you're not looking where you're going and you bang into something, right? So it could be, it's almost always accidental, but then let's think about somebody who gets into a fight, right? So all of these are scenarios in which someone can get a concussion. So how do you manage a concussion, right? So management is actually physical and cognitive rest, right? They gotta rest. You can put them to sleep, or you can make them do very low intensity activity. If it's a child, then he can be excused from his classes at school, and they have to return to activity rather gradually. And there is this common misconception that someone who goes to sleep after a concussion can actually slip into a coma, but that's actually not true. It is shown that someone who doesn't get enough rest and sleep after a concussion is at risk for what is called post-concussive syndrome, which is like the symptoms of concussion when they last longer than 3 months after the injury. That's called the post-concussion syndrome. And in that, people tend to have, like, long term focus issues, behavioral issues, and just like, all the normal stuff that happens after head injury. So, lot of rest, good sleep, and gradual return to activity is the standard of care for a concussion. And obviously, the patient has to be monitored closely to make sure that there is no further neurological deterioration. Okay, so that is about it for concussion.